As a paramedic, I realized that doctors can be unapproachable or approachable, and so you have a variety of physicians. To pick a personal physician is probably the most difficult task. It's like buying a car. You have to research, and researching a physician means you have to be able to interview someone. This person is going to be guiding your health care, hopefully for the rest of your life. Training in the law enforcement was an interesting task, as I'm dealing with primarily a male-dominated force, and I found that their health was pretty much neglected. I liken it to they wear the vest and they have that attitude that they're impervious to pain, but their health, meaning their blood pressure, their blood sugar levels, went undiagnosed. So I found that I was able to save more lives in the classroom than I ever did on the ambulance. You want to actually have a baseline, and I always encourage them to get what I call a Polaroid picture of their good health. So if they're in good health is when I want them to go to a doctor, because as you age, then new things develop, and the doctor then can see a trend and proactively maybe interfere with any onset. So that includes, a blood panel. It includes the lipids, triglycerides, the PSAs, all of the things that men generally don't think are necessary. And I had to educate many of them that these lab tests are basically a picture that the doctor can then infer whether you're aging appropriately or you have a disease entity that is now taking over. Go to the doctor when you're sick doesn't do anybody any good except yourself. If you go twice a year, one of those times you're going to be very healthy, and the doctor can spend some time to see which you are in good health, both mental and physical. This allows them to see a change. So if they see a change in your affect, your attitude, they can ask you certain questions that might reveal an underlying pathology. Men generally have a fear that they're going to find out something wrong, and they'd rather not find out. And if it doesn't hurt, it's not broken, why bother fixing it? I've often said that you should treat your physician like your priest. You should trust that it won't go anywhere outside the room. It is between you and them, and it is probably the most important relationship you'll have for good health. I have found that St. Mary's, when I came to St. Mary's, hospitals are hospitals to me, being a former paramedic, but I found the people at St. Mary's to be the best part of the whole experience. The medical offices of the physicians surround the hospital. That makes it one-stop shopping, if you ask me. It's easy, it's convenient. It doesn't use a whole day of my time if I have to come in. And that, I think, is one of the larger problems. People have to travel so far to go get their medical help, they don't do it.
Any other last thoughts?
Get yourself a doctor. It'll be the best investment of your life.